Welcome to the COVID-19 Researcher Spotlight Series. Today, I'm joined by my colleague Nicole Kolesoglu as we interview 2014 Passion in Science Award winner and now frequent guest of CNN and NBC networks, vaccine expert Dr. Peter Hotez. Dr. Hotez is Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, where he is also the co-director of the Texas Children's Center for Vaccine Development. Dr. Hotez, thank you so much for joining us today to share your expertise on vaccine development and distribution, particularly in light of the COVID-19 vaccines available.
Oh, well, thanks so much for having me. It's great to be here and great to get reconnected with New England Biolabs.
Absolutely. And we're also joined today by my colleague, Nicole Kolesoglu. Hi, Nicole.
Hi, Lydia. Hi, Dr. Hotez.
So, Dr. Hotez, I wanted to jump right in and talk to you about your new book, which is titled Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science. And I wanted to ask, what are some of the overarching issues you address in the book that can impede the ultimate impact of biomolecular research?
Well, I think, one of the big issues is I started writing the book well before COVID-19 struck. And because I had seen kind of an unraveling of a lot of our past global health gains. And it was not happening universally. Since 2000, we'd seen the scale up of treatment for neglected tropical diseases, including parasitic worm infections and vaccine preventable diseases. And then uh, starting around 2015, there seemed to be this slow unraveling in selected areas. But it was happening due to forces that we don't ordinarily think about as biomedical scientists. It was happening because of things like war and political collapse on the Arabian Peninsula, or from the Boko Haram areas in Nigeria, or the socioeconomic collapses in Venezuela. And it was also paralleled by things like climate change. But it wasn't climate change just happening in isolation. It was working in concert with those forces. So, I was starting to hear, people talk a lot about climate change and the role in promoting disease. But my observation was it wasn't just climate change acting alone. It acted in interesting and unique ways with these different social determinants. And then there was this big rise in anti-science forces. So I thought it would be interesting kind of pull all that together in a book to point out how these modern forces are bringing back disease, intended mostly for general scientific audiences, to kind of in the biomedical sciences, but to introduce them to the fact that there are things going on that they never hear about in graduate school or in medical school, but to put them on notice that these are going to be the big drivers bringing back disease. And then, in it, I was already talking about coronavirus infections and predicting that this was going to be a big problem. And then, bam, we learned in New Year's Day a year ago that COVID-19 had struck Wuhan and ultimately Hubei province and much in areas of China. And then it was off to the races from there. And so I wound up having to modify the book to incorporate all the new information about COVID-19. And we'd been working on coronavirus vaccine, so it was not too difficult to do. And so the book is called Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science, and it kind of gives you a flavor of what you're in store for.
Yeah. Do you think that scientists should be concerned about the anti-science movement?
I think we have to be. It started out as a fringe group, as in the anti-vaccine movement, starting in the early 2000s, but then it took this odd twist to the political extremism on the far right in 2015 under this banner of health freedom, medical freedom, and then parents started withholding vaccines from their kids in certain states. So, especially in Texas, where I was, where Texans for Vaccine Choice and other anti-science political action committees had mobilized to convince the legislature to make it easier and easier to opt their kids out of getting vaccination and harder to vaccinate our kids. And being in Texas, I could see it firsthand because I have a daughter with autism and intellectual disabilities. That's when I wrote my first book on this subject called Vaccines Did Not Cause Rachel's Autism. And one of the themes, both in the last book and this book, is the fact that these anti-vaccine groups, which are now full-on anti-science groups, because they glommed on protests against masks and social distancing in 2020, the same groups that were anti-vaccine before now were full-on anti-science, because there was not only just vaccines, but against everything else related to COVID prevention. I really started to feel that a lot of this was happening because they were enabled. They were enabled because as scientists we're silent. We're so focused on our experiments and our grants and our papers that doing things like public engagement and refuting some of the claims of the anti-science groups are not seen as front and center of what we should be doing. And I think more and more it's going to have to be if we're going to take this on, because we've seen the dangers of what anti-science groups could do. And, it's the fact that we now have 400,000 Americans who've lost their lives is not only because of COVID-19. It was COVID-19 in the context of vast sections of the U.S. population who believe COVID-19 is a hoax and the deaths are due to other causes, and a lot of this, and that masks don't really work, and they believe that hydroxychloroquine does, and all of this came out of a deliberate disinformation campaign from the White House, and I was uniquely poised to go after that because I'd been going up against anti-vaccine groups for so many years. So I think a key message from my recent writings has been this is a new era, and as scientists, we don't have the luxury anymore of just staying focused on our grants and papers and lab meetings. As important as that is, there's going to have to be another piece to this.
So it is certainly troubling. Dr. Hotez, does a useful framework exist that can help scientists to improve their own scientific communication skills?
Well, there's not there are bits and pieces of things out there. The Alan Alda Center and AAAS has definitely stepped up to put on a lot of programming, and in Boston, the American Academy of Arts and Sciences has been looking at this, but it's not really ingrained in our training, and I think that's going to be another important element. So I wrote a piece in PLOS Biology that basically said I think we have to provide that training, because there is a way to do this, and you know that because you see all the mistakes that the White House Coronavirus Task Force did in 2020. I mean, the disinformation aside from specific individuals, the others who were well intentioned, made one of two major mistakes. One, they would lapse into jargon and charts that nobody could interpret. But the more common mistake was they talked to the American people like they were in fourth grade or sixth grade, because some expert in communication said you have to talk to the American people like they were in the fourth grade or sixth grade, and it was very off-putting. And one of the reasons I think I've been effective is I don't do that. I try to take the time to explain complex ideas, but do it in steps. And to my happy surprise, people seem to like it. People don't mind the complexity. They really want to understand, and they want to understand so they can protect themselves and their family members and their friends. And that maybe is one of the modest silver linings in COVID-19, is people realize they like to hear from scientists, and they don't want it all pre-digested and filtered and be spoken to like they're in the fourth or sixth. And so that provides a little window of opening. The problem is this: we don't offer that kind of training right now, really, in doctoral or postdoctoral education. I think the young scientists would love it. The commitment among young people to public service is at an all-time high, despite what they say about you guys. The truth is, I can tell you firsthand from dealing with young scientists that they're all in. They want to be out there engaging. But the other problem, aside from the lack of training in the doctoral and postdoctoral level, is that you're not encouraged to do it by the academic health center or the university. They're still very oftentimes dominated by offices of communication that see this as a risk. They're very risk averse, and they don't like their docs and their scientists speaking out necessarily, and they're all about protecting the reputation of the institution, and they often see that as a threat. So it's not really encouraged. So the fact that you're speaking out as a scientist about social justice or combating anti-science, that's not their thing, and so that kind of puts you in conflict. So that's an issue that needs to be resolved. Also, right now, it doesn't contribute towards your career advancement. So, for instance, I get evaluated I'm a professor and a dean. I get evaluated like everybody else. And what's on my annual evaluation form? It's my grants and my scientific publications, also my grants and my scientific publications. And my scientific publications. Right? There's nowhere on there for an op-ed piece that I've written or a commentary or much less daily appearances on MSNBC and CNN. And so the subliminal or not so subliminal message is, what I'm doing to engage the public is not really valued. And don't do it. I think that's a problem. And God forbid there should be something on the annual evaluation form for followers on Twitter and things like that. I mean, that's just,
Yeah, that might be asking
that's
a
not
lot.
going to happen till the glaciers come back up in Quebec. Right? So we've got a lot of work for us. So the whole ecosystem needs to change, and it has to change, because the anti-science movements are becoming so dominant right now. And so what was a fringe element coming out of Texas and Oklahoma, there are now national groups committed to this, and now those national groups are exporting this to Western Europe. So all during the summer of 2020, you had rallies, anti-mask, anti-vaccine rallies in Berlin and London and Paris. That all came out of the anti-vaccine groups that started accelerating in 2015. And it's taken these awful turns, not only to political extremism on the right, but even to QAnon. And on top of that, you've got the Russians that have implemented a program of what we're now calling weaponized health communication on the internet. And you see it if you follow me on Twitter. You'll see the stuff coming out of Russia. Put on Twitter. And so this is an international problem. Anti-science is becoming as dominant as science. And what do we do about it? And how do you explain it to people? And this is one of the things I'm struggling with now, because I start talking about far right-wing extremist groups and QAnon and Russians and the Murdoch media empire, and you start sounding like somebody who throws things at the TV at night. So how do you say that in a start saying in a credible way that's believable, even though it's all true? I still haven't found the right way to really explain it all, but it is a threat. And so I've been writing about this, and I've written some of it in the lay press, but I'm trying to write a lot in scientific journals. So PLOS Biology and some PLOS journals have been good about letting me write about this, and Microbes and Infection also.
Well, you certainly are doing a good job sharing that information on Twitter. And just so everybody knows, you are at Peter Hotez on Twitter, so they can find you there.
Right.
And to stay on the thread of sort of the status.
And Twitter, I have mixed feelings about as well, right? I mean, it's one of the things I don't do on Twitter is get into Twitter arguments or discussions. I find it could be a real time sink. Lady Gaga, who sang today at the inauguration, said one of the great quotes. She called social media the toilet of the internet, and I think she's partly right. So
Yeah, she does.
lessons learned from Lady Gaga. Don't. I use it as a vehicle for my writings to get out there and to make important statements, but I tend not to go in the rabbit hole of getting into arguments with people, and it's just it can really be a time sink.
Yeah, and emotionally draining as well, I think.
Yeah, and the cyberbullying from the anti-vaccine groups is, of course, brutal. But then again, I try to use that as a teachable moment. So one of the things that I do is, I get heavily attacked both from the far right-wing extremist groups linked to the anti-vax homegrown groups in the U.S. and then the Russians. And when I can figure out what it's coming from, I try to highlight it and point it out. And I find that's very teachable also, so people can see what's actually going on with disinformation that's become such a dominant theme. I'm sorry, I interrupted you with that. That diversions.
No, that's absolutely very important. Thanks for sharing that message. I wanted to stay on sort of the subject of altering the status quo. And to that end, how does the COVID-19 pandemic, do you think, demonstrate that investments in non-money making vaccines against emerging diseases can help us prepare for future outbreaks?
Yeah, I mean, we still haven't fixed the business model, right? Because the big pharma that's interesting when you look at the big vaccine companies, the sort of the old blue chip companies, right? Merck and Company, GSK, Sanofi, they're not really in it in a big way, right? So most of them are either, Moderna is certainly not a vaccine company, neither is AstraZeneca. And Pfizer, yeah, they definitely are doing vaccines as well. But, a lot of this, I think the driver it was a great way to get, I think there's definitely a humanitarian drive among the scientists, but I think a lot of it also for the company is it's a great way to accelerate the mRNA technology and the adenovirus technology and to get government financing for it. So it was a great economic stimulus plan. Also, it helped get that technology through the regulatory pipeline in a way that they probably wouldn't otherwise. So now they're going to be able to turn it around for cancer vaccines and gene delivery technologies, which is totally fine. But it also points out the fact that we still don't have now vaccines still for low and middle income countries. Those mRNA vaccines are unlikely to really filter to the LMICs anytime soon. The technology is still expensive and it's clunky. It's complicated, right? In terms of scale up production, and then you've got sort of the Russians and the Chinese sort of bypassing WHO pre-qualification, although now they're trying to get re-engaged, which is good. So when you look at the vaccines that are out there for low and middle income countries, there's not a lot out there. There's the Johnson & Johnson adenovirus vaccine that was originally developed by Dan Baruch at Harvard Medical School. There's the AstraZeneca Oxford vaccine, of course, at Oxford. Then there's our recombinant protein vaccine that we're scaling up production for in India now. And that may be it. So there's not that many options out there. I mean, the Sanofi one is delayed. The Queensland one got delayed because of the HIV sequences in there and one of the clamps that they use. And so that's going to slow or derail it. So I'm quite worried about the LMICs.
And how are things going with your vaccine?
It's good. I mean, we with Baylor, we did a license, non-exclusive license to Biological eBioE in India, which is one of the big producers. And as I said, they're making 1 billion doses, which is amazing. We've never made 1 billion of anything before, so that's. Although somebody pointed out when we put the yeast into the fermenter, that's 1 billion or more. So literally, that's true. But and now testing across India. So it's a great honor to be able to make that impact. But we really had to struggle, right, to get that funded. We're not part of Operation Warp Speed because we're not a pharma company. So we had to really, one of the hardest things I did in 2020, and I'm still doing it, is desperately seeking funds to do it. So because even though we had made the SARS-1 vaccine and we were fine tuning it to make it. We still needed funding to move this along. So we got some support from interesting sources. So Tito's Vodka came to the rescue for us. So
That's amazing.
the next vodka drink, anyone who's listening, it must be Tito's
Yeah.
Vodka.
Well, maybe I'll have one. I'll have one in your honor today.
Yes, I think we all will. Just also celebrate the inauguration too. And then, JPB Foundation, the Clayburgh Foundation, and MD Anderson Foundation, and a little bit of NIH money. But, it's amazing how far you can get with when you work on neglected diseases, as you know from New England Biolabs, a couple of $1 million goes a long way. And we were able to really stretch that.
Yeah, it sure does. So, could you tell our listeners how you define vaccine diplomacy?
Yeah, this concept originated. The way I like to think of it, it actually started with Edward Jenner, who made the first vaccine. He was called upon to mediate prisoner exchanges between the British and the French during the Napoleonic Wars, because he was giving his vaccine to the Europeans, and ultimately sent his vaccine to the U.S., where it was used in the Lewis and Clark expedition in the interior. But the modern form is really, I attribute it to Albert Sabin, who developed the oral polio vaccine jointly between the Russians in the U.S., the Soviets in the U.S. at the height of the Cold War, right after the Sputnik launch. And the two countries put aside their ideologies to work together to really shape that oral polio vaccine. Sabin sent his oral polio strains to the USSR, and that was first scaled to immunize 10 million children in the USSR. So that's an extraordinary story. And the question is, can you bottle that? Can you franchise it? Can you make this happen on a regular basis? And I was given that opportunity in the Obama administration. I served as U.S. science envoy, focused on the Middle East and North Africa to build vaccines jointly within the U.S. and Middle Eastern countries. Really exciting. With some successes, more failures probably than successes, but it was a very exciting time. And I think that's really important, because the opportunity to do international science, to build new vaccines, drugs, diagnostics together is so important, especially now. In the last year, we went in the wrong direction with the Russians and the Chinese taking their vaccine of uncertain quality and then making one-off deals with countries in a very sort of old Cold War fashion. And even there's a new term that's been coined for it. It's called vaccinationalism, and it's the opposite of vaccine diplomacy. And so hopefully we have to get back now to vaccine diplomacy. And then you had the U.S. pull out of the WHO. That will be rescinded now and pulled out of the COVAX sharing facility. And then you had that very odd executive order from President Trump that basically declared eminent domain over all vaccines for the U.S., which I don't know how that's supposed to work when a lot of the Pfizer vaccines are made in Belgium and in Germany and elsewhere. So, but hopefully we'll get back on track now with this concept of vaccine diplomacy and what CEPI is doing to finance. CEPI is the Coalition for Epidemic Preparedness Innovation. It's associated with the Wellcome Trust and the Gates Foundation and WHO and Gavi and the Norwegian government, the Indian government, and a few other partners. And hopefully that's helping to finance our vaccine somewhat now for India. And hopefully we'll start seeing more of that vaccine diplomacy flourish now at this new time. I think one of the things that I took for granted and I don't anymore is how important U.S. leadership is for health diplomacy and for global health. And when the U.S. went on this go it alone strategy, it really hurt our ability to provide access for essential medicines and vaccines for COVID-19. And it's just screwed up the global governance. Create those vacuums, bad stuff happens. And that's what happened with vaccinationalism.
Yeah. Sounds like you can't end a pandemic unless you end it everywhere, right? You need vaccine diplomacy.
Absolutely, absolutely.
Do you have an example of a hurdle to delivering COVID-19 support to poor countries or even poorer communities within rich countries that could be addressed by currently available biotechnologies?
Yeah, I mean, this is one of the important themes of COVID-19, that it's been disproportionately affecting the G20 nations, right? The US, England, the European countries, Brazil have been hit really hard, but especially in the low income neighborhoods. And that's been true of, in the Hispanic neighborhoods across Texas, really hit very hard because the illness causes higher death rates in people under the age of 65. 30 to 5% of the deaths among Hispanic communities from COVID-19 are in people under the age of 65. So people, mothers and fathers in their 40s and 50s and early 60s. And so that's another book that I wrote called Blue Marble Health, which is not widely accepted. I think it's an important theme, but people don't generally accept it or talk about it much. And it says the following: when we think of global health problems, the paradigm is developed versus developing countries, or poor versus wealthy countries. And when you actually add up the number of poverty-related neglected diseases, what I find overwhelmingly is that it's looking at whether it's worm infections or leishmaniasis or leprosy or dengue or tuberculosis. It's the poor living in G20 nations that mostly accounts for it. So, and I gave it this new name called Blue Marble Health to just brand it differently from traditional norms of global health. And I think that COVID-19 is going by the same playbook.
So, is there, one achievable action that society could take as a whole today that would really help the most vulnerable people in this pandemic?
Well, aside from the socioeconomic levers, which I know is a big component of that 1.9 trillion stimulus coming out of the Biden administration, I think is trying to prioritize some of the more traditional vaccines is going to be very important. I think we went pretty heavy on the innovation, and it's exciting technology, but I think it's still too new and too immature to put all of our eggs in the mRNA and adenovirus vectored basket, certainly the mRNA basket at this time. So bringing on some more oldies but goodies in terms of traditional technologies like our recombinant protein vaccine, maybe some of the inactivated virus vaccines. I think we have to pivot towards some of those as well, and be able to scale those up more. That would make a difference because they tend to be more durable in terms of how hardy they are, and keeping it at refrigerator storage, and they tend to be low cost. I think ours, we're going to try to cost it out about $1.50 a dose, so it's really inexpensive. This is yeast fermentation technology. You do a 3,000 liter fermenter run, you can make a lot of it, and it's the same technology used as the recombinant hepatitis B vaccine that's used all over the world. It's been given to kids for the last 40 years. So I hope that ours can get up there pretty soon.
Yeah, well, $1.50 is a lot less than $20 a dose. And
Yeah,
this,
it makes a difference, right?
yeah, that is,
Right. Because right now, if you look at the Central American countries, they don't have access. Most of the Latin American countries don't have access to vaccine. Um, some of the poorer Asian countries may not, or they're making deals with the Chinese. And right now, COVID-19 is not a huge problem in sub-Saharan Africa for reasons I don't never really fully understand. I mean, all the reasons given just don't add up to me. Now that we have the UK variant, now the new variant coming out of Manaus in Brazil, the South African variant, what happens when that starts racing through sub-Saharan Africa? this could be a real slaughter. So I'm really worried about that as well. And we're going to need to have low cost, non-fussy, durable vaccines for the African continent, and pretty soon.
Yeah, to that end, do you support the goal of locally produced COVID-19 vaccines?
We try. There's a network that actually calls themselves the Developing Country Vaccine Manufacturers Network, and so we did a license to BioE in India, but the network extends to countries like Indonesia and Vietnam and Brazil and Cuba. And
Do you believe that there is an area of infectious disease research that more biologists should be taking on today? Or which biomedical problems do you think need an influx of scientific talent?
well, I think the needs are pervasive, right? For not only infectious diseases, but how you deal with cancer in Africa, or sickle cell disease, diabetes, and
Mm.
racing through Africa and India now. So what our definition of global health. I get a lot of young people ask to say, "Hey, Dr. Hotez, I want to be like you, studying tropical diseases." And I say, "Look, it's great if you want to do that, but now we've got everything all over the world, and I think the key is just to get well trained as a scientist." And I have a paper that came out a couple of years ago in PLOS Biology, that is, talks about how the needs to do, RNA-seq and all the systems biology, we need to apply that to illness in low and middle income countries. So there's a huge need for that, and 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 so the key is to get well trained in rigorous thinking, and do a deep dive in technology, or deep dive in thinking through a problem. And that will equip you well when you want to start applying it to solving problems across the world.
Absolutely. Thank you so much for joining us today, Dr. Hotez.
Well, thank you. And thanks to New England Biolabs for all of your encouragement, and for what you're doing for the world. Is so important.
Thank you. And we've been so happy to get to know you and continue to watch you succeed at your work, and continue to watch you really bring vaccine awareness and education, as well as scientific communication, to the forefront of your messaging. And we really appreciate that.
Thank you so much.
Thanks for being the voice of reason.
It's tough. For me, one of the hardest things in 2020 was going up against the White House and the coronavirus task force. And because the message as a scientist, again, from your bosses and everyone else, "Hey, just Peter, fine, you want to do that, go ahead, but just stick to the science, stick to the science." And then what you saw was how the White House was deliberately tying anti-science to political allegiance on the far right. And the only way to disentangle it was to call it out. It wasn't that I was being political, but you couldn't just pretend that it didn't exist. And my wife Ann saw how upset I was getting, and finally said, just go for it, because you don't want to wake up months from now and realize the death toll from COVID-19, and realize that you didn't do all you could have to stop the death and destruction. So that's what I did all through 2020. And and in retrospect, I'm really glad I did it, and I think it did help save lives. But and no question, it took a pretty big emotional toll on me and family. And
Well, thank you to Anne as well.
Yeah, big thanks to Anne and the rest of your family for supporting you, and thank you for taking a stand. It's an important time to do it.
Yeah, and marry for love. That's another piece of it.
That's
Perfect.
the best advice.
That is wonderful life advice. Thanks so much. Thanks for joining us for this episode of the COVID-19 Researcher Spotlight Series. Join us next time when I interview Todd Kamenisch, professor and chair of the Department of Pharmaceutical Sciences at St. John Fisher College in Rochester, New York. Todd has been spearheading wastewater surveillance testing at the institution, and we'll discuss how the program works and how results are guiding the precaution and mitigation efforts, as well as further testing at the school.